Welcome to the Heart Clinic. My name is Jürg Grünenfelder. I'm here with my colleague Sasha Salzberg. We are both cardiac surgeons at the Heart Clinic in Zurich, and we want to show you and demonstrate you a case of an 83-year-old lady who suffers from severe shortness of breath for several days and got transferred to our institution.
Upon arrival, we performed a cardiac ultrasound, as you can see on the screen behind us. This demonstrated severe mitral valve insufficiency with a prolapsing posterior leaflet. The color shows you the flow of blood going from the left ventricle to the left atrium. And this is a problem mitral valve repair can fix very well.
Since the lady is fairly old, we discussed the case within our heart team, and we decided that we're going to offer her a minimally invasive mitral valve reconstruction surgery, which we usually perform with a robot in our institution.
We would now like to offer you the unique opportunity to join us in the operating theater and watch us perform this case.
Thank you very much.
And we hope you enjoy the movie. Welcome to the operating theatre in the Klinik Hirslanden in Zurich. In this operating theatre we perform all mitral valve procedures with the Da Vinci. Cardiac ultrasound is the first step in assessing the problem and defining a precise operative strategy. The next step is to connect cardiopulmonary bypass through the groin and to gain access to the chest through a 4 cm incision in the right chest. Ports are inserted, and then begins the delicate maneuver of docking the robot to the patient. Once this is done, the three-dimensional optic can be inserted into the chest. Principles of Da Vinci surgery are that there is one surgeon sitting at the console, and the robot transmits the movements of the surgeon's fingers in the chest. There's a table-sided surgeon whom assists the console surgeon and the robot in different maneuvers such as tying knots, inserting rings, and changing instruments. Principles of mitral valve repair are to preserve the patient's own leaflet tissue. This leads to excellent long-term outcomes. The Da Vinci robot is an enabling technology which assists surgeons in achieving this goal. Once the procedure is finished, once the mitral valve is reconstructed, cardiopulmonary bypass is weaned, and the result is assessed on echocardiography. When this is considered perfect, the operation is finished, cardiopulmonary bypass can be removed, the robot can be removed, and the access sites are closed. The patient can now go back to the intensive care unit.